is set to receive just over 40,000 doses of the COVID-19 vaccine. The province is yet to announce its distribution plan. To tell us more, I'm joined by Limpopo Premier Stanley Mathabata. Thank you very much, Premier, for your time. Let's start off with the number of doses that have been allocated to Limpopo for phase 1 rollout. Can you confirm how many doses you're getting?
Yes, we are at 44,000. In fact, it's 44,600 and something. I don't have the exact statistics, but I can quickly,
for the time being, that's sufficient. Thank you very much, Premier. So how many eligible frontline healthcare workers are there in the province who would be requiring that dose as part of phase 1 rollout?
We are exactly at 44,500, I think.
Okay.
Yes. But like I always say, the detail is with the Department of Health. But from the side of the Command Council, Provincial Command Council, we got the figure of 45,000.
And will those doses be administered to healthcare workers at identified sites, hospitals, places of work, clinics? Can you give us a number of sites that have been identified specifically for administering those vaccine doses to healthcare workers in phase 1?
The way in which it is going to work, we are going to request people to register online. Some will be registering at our various health facilities, so that at the end of the day we can be sure, very sure, as to how many amongst our current frontline workers who are going to get these doses, the vaccination, and how many because you would get some people who are saying, based on my religious belief, but based on 1, 2, 3, I'm not interested in getting a vaccination. So the registration will actually be in the position to can give us exact statistics.
Much of the province is populated by rural communities. How will doses be transported to and stored securely in remote locations?
Remember, despite the fact that we are very rural, or perhaps having been informed by that, we made it a point that we buy state-of-the-art ambulances, 50 every year since the year 2015. So for the transportation of those, the infrastructure for transportation of this medication, there is exactly, we are ready, let me just say we are ready to can take them to anywhere. Even deep rural areas in our province will be able to access that health facility and vaccinate people.
So those ambulances you speak of, they are equipped with cold storage facilities on board?
Yes. Well, I'm not sure as to whether they will be distributed, they will be transported through the ambulances. But what I'm trying to say is that I'm just indicating the kind of capacity that we have in terms of transporting whatever, including this what you call the vaccination. Obviously, as you would know, the cold storages that transports this vaccination will actually need something that an equipment that can take about negative 17 degrees, and that is exactly what we have been using when we were transporting other vaccinations even before this COVID-19 vaccination. The equipment that we're using, the cars, the vehicles that we're using to transport other vaccinations, malaria or whatever, will still be equipped to can deal with this other vaccine also, the COVID-19 vaccine.
Premier, what is the time frame for completion of phase 1 for that first dose of phase 1?
3 weeks. Phase 1, it will be 2 to 3 weeks. And then we don't as yet have the time frame for phase 2. But with phase 1, we are sure that within 2 to 3 weeks we'll be done with it.
We've also heard that generators might pose a problem for rural clinics in terms of storing the vaccine, as that cold chain cannot be broken. Do clinics in rural areas in Limpopo have adequate generators should load shedding pose a problem?
That used to be a problem for us. But I think in the past 5-6 years, yes, we have never had that problem again, because we came up with an intensive program to ensure that you don't have a situation where a hospital runs out of power, maybe because the generator was not properly serviced or there is no generator. In the past 6 years, we haven't had such reports that we've got problems with generators and the like.
Premier, do you have a figure? Apologies for interrupting you there. Do you have a figure for us on the province's total spend since the start of the pandemic, and that's everything related specifically to COVID-19?
Total spend for everything? No, I wouldn't have that kind of figure.
Are you in the process of trying to collate that data? We're hearing from some other provinces the figures that they have spent, and we'd like to get the same kind of figure for Limpopo.
Yes, we are. We do get those reports. We do collate it almost on a monthly basis. But what I'm saying to you is that I would not be in the position to can, off the cuffs, say this is the figure. I don't have the statistics with me here.
Understandable, Premier. However, South Africans are hesitant about receiving the COVID-19 vaccine and are reliant on leadership on a provincial level, on a municipal level. They're reliant on us as the media for information to set their minds at ease. So I'm sure you can understand that South Africans would be wanting to hear on a regular basis the kind of details pertaining to specifics of the vaccine rollout.
Now we can make that available. I thought you were saying you wanted the amount for the money spent for this COVID-19 since it broke out in our country and province in March last year.
That was one of my questions. However, do you have figures at hand specifically for how much the province has spent on vaccines so far?
Yeah. On what? On vaccine?
Yes.
No, the vaccine is going to be procured via the National Department of Health. It's not going to be procured through via the province.
And in terms of secondary supply chain, has the province spent money on that?
On the vaccine, no.
On secondary supply chain, for instance, transportation, training of nurses, disposables such as syringes, PPE, identification of vaccine sites?
Obviously, from the side of the Premier, I would not be in the position to can have such figures off the cuffs. I mean, from the top of my head saying this, that is the role that is supposed to be played by the head of the Department of Health and the MEC. I don't think I will be in the position to can do that, unless if I am requested to bring those figures. Yes, I'll ensure that I source them from the responsible authorities.
Thank you very much, Premier. We are going to leave it there, and perhaps then we will address those questions to the MEC for health in the province to try and establish those facts and those details more accurately. Thank you very much for your time. That was Limpopo Premier Stanley Mathabatha.